Hi, I'm Admiral Rob Ray, CEO of Blue Star Telehealth. I know you're busy, but I'm hoping you'll take just a couple of minutes to consider 4 points that I think will be of interest to you. And if you do have interest, please follow up with the Blue Star sales rep who sent you this video. The 4 points are about telehealth, remote patient monitoring, the software you need, and the easiest way to make all that happen without hassle. I'll try not to be too much of a salesman, and I'll try to be quick. Point 1, telehealth. You've heard everybody talking about it. Well, it's not just a COVID-19 fad. It was growing by leaps and bounds before COVID, and it's here to stay. In a recent study of 1,800 Americans, half had already had a virtual appointment. 83% said they were ready to use telehealth both during and after this COVID pandemic. 70% said that simple technology would encourage them to use telehealth more, and 60% said they'd use it more if their doctor told them it was available. And finally, another study projected growth of about 40% annually for the next few years. That's a 7-fold growth by 2025. 7-fold. And it makes sense because patients love it. Why spend half a day traveling to a medical appointment, sitting in a waiting room and all that, when instead you can just talk into a computer from your home? People say it's the way of the future, and it seems like a cliche. But for much of medicine, telehealth, helping people to be healthy at home, really is the way of the future. Heck, I just had a telemedicine session myself last week, and I know I appreciated its convenience. So point 1 is embrace telehealth because it's here to stay. Point 2, there are a bunch of subcategories of telehealth. Transitional care management, chronic care management, principal care management, patient self-measurement, annual wellness visits. But the simplest one and the enabler for all those others is remote patient monitoring, or RPM. RPM is pretty straightforward. The doctor prescribes a device that the patient uses in her home to measure something, let's say blood pressure. The patient measures her blood pressure using a digital wireless blood pressure cuff that talks to a hub in the home. The hub might be a video tablet. That hub sends the data to the cloud, where it's stored in a secure, HIPAA-compliant software. That software sends the data where it's needed, to nurses, to doctors, to family members of the patient if appropriate. Now, there are several simple steps to making RPM happen. First, the doctor prescribes RPM for a particular condition. Second, we program the equipment and send it to the patient, and then we train her on its use. Third, we manage and maintain the hardware and software to help the patient manage her health. Fourth, a nurse or a qualified professional reviews the data daily and keeps the patient engaged. And fifth, when a problem is detected, the doctor's clinic follows up with the patient for additional attention. The idea of RPM, it's like a continuously operating smoke detector. It's to identify problems early before they become bigger problems later on. And it works. RPM can nearly double the rate of hypertension control. Statistics show it results in fewer hospital visits, greater patient satisfaction, and improvement in overall health. So that's just why, beginning a year or two ago, CMS started reimbursing for it with a couple of dozen RPM-related CPT codes. They realized that an ounce of prevention is worth a pound of cure, that it's smart to spend a penny to save a dollar. But by paying to detect and fix a patient's hypertension is way more cost-effective than paying to help her recover from a stroke. Point 3, RPM has some hardware, but the key is in the software. The software collects the information from the hardware device. It stores it, analyzes it, sends alerts. It displays it for caregivers to view and act, and it generates the documentation for CMS billing. Now, frankly, there are a bunch of RPM softwares, and more are popping up every day. I'm guessing that you've run into some of them. Last year, my company and I conducted an extensive analysis of the RPM software we wanted to use for our patients, and we chose VitalTek. We found it to be the most intuitive, the most useful, the most flexible, the most cost-effective, the most proven. We met with the founders and engineers, and we chose VitalTek to take care of our customers and their patients. Now, VitalTek isn't a couple of guys in a garage writing code. It's an established, reliable, stable, grown-up company with huge national customers, which is important when you're picking a software to help improve patient outcomes. I could go on singing the praises of VitalTek, but I told you that this wouldn't be a sales pitch, so I won't. Again, if you're interested, we'll give you more info. The bottom line is this: we looked closely at a half dozen softwares and we chose VitalTech. We didn't invent the software. We're not bragging about our own product. We chose it, and that's the difference. And finally, point 4, logistics. RPM is great for patients, but it's also great for doctors because it improves patient outcomes and it allows you to increase care and increase revenues. The revenues from telehealth will far exceed the costs of the RPM platform, which allows you to provide those telehealth services. Let me say that again. The revenues from telehealth far exceed the costs of the telehealth platform. Now, RPM takes some logistic effort to make it work. Equipment purchasing and inventory, programming and kitting and shipping, training the patients, maintaining the hardware and software, monitoring the data flow, retrieving and refurbishing used equipment. And you have a choice. You can do all that if you want. Some doctors do. Some just rent the software and do the rest yourself. And if that's what you want to do, we'll help you. But the second option is to outsource all that non-clinical stuff to somebody who does that for a living. That's where we at Blue Star Telehealth come in. We do all that RPM logistics stuff so you can focus on what you do best, which is taking care of patients. I'll only brag for a few seconds. We're veteran owned and operated. I'm a retired 2-star admiral, as is our chief operating officer. 15 generals and admirals on our advisory board, including doctors and nurses, certified by the Veterans Administration, won the SBA Small Business of the Year Award, A+ rating from the Better Business Bureau, 500 positive reviews on the webs, 5,000 clients across all 50 states. Okay, bragging over. If you decide to outsource all the non-clinical stuff, we'll do all the work. You bill CMS and you pay us a portion of what you collect from CMS for the purely RPM CPT codes. And all the dozens of other telehealth CPT codes are yours. You use the RPM system we provide to do it all at no cost. So that's it. In summary, telehealth is the way of the future. Get on that bus. RPM is a singular form of telehealth that provides a reimbursable platform that allows you to do all that other telehealth stuff. It's a HIPAA-compliant video device in the home with your name on it, which allows you or your staff to communicate directly with the patient at any time and bill for it. Number 3, VitalTech is absolutely the best software platform we've found for this. And number 4, if you choose to outsource RPM logistics, we believe Blue Star can be a reliable, credible, friendly, trustworthy, cost-effective partner to do that. If any of this is interesting, please let us know. We can send you more info to read. We can arrange a Zoom meeting. We can talk on the phone. The RPM market is exploding. If you're not interested, that's okay. We don't want to bother you or try to talk you into it. We'll go bother somebody else. In any case, thank you and God bless you for the difficult work you're doing during these difficult times. My youngest daughter is a nurse treating COVID patients every day, and I'm as proud of her as I can be. I'm an old admiral who has people come up to me and say, thank you for your service. Well, I say to you caregivers, thank you for your service, and thanks for listening.